Almost 16 years ago now, Dr. Stephen Lantier and I left the operating rooms of the big hospitals and began our practice in operating rooms that we owned. Looking back on our decision to leave our very busy hospital practices behind and take this risk, I now realize that we did this in spite of all the information that we had, in spite of all that we'd been told by those involved in healthcare. Our distrust of hospital administrators and the corporate hospital world had become so complete that what I now understand to be an entrepreneur's business calculation was actually made assuming that all we had been told was false. This, it turns out, was good judgment on our part. At a recent conference conducted by the Mises Institute in Houston, one which seemed to focus on the difficulty that entrepreneurs have in the current business environment, I came to the conclusion that we started our surgery center not based on a typical business pro forma type of plan, but based on the belief that everything that we were hearing from hospital administrators about the business of healthcare was untrue. Propaganda meant to discourage physicians from doing what we were actually setting out to achieve. The anxiety we endured in pursuing this venture was mitigated by how troubled the hospital administrators were by our even considering making this move. Indeed, we had been told numerous times that the operating room staff needed to be downsized because the hospital simply could not make ends meet. The revenue generated by surgical cases was inadequate to pay sufficient staff. Large and unacceptable patient-to-nurse ratios in postoperative surgical areas and suites were justified with the same lies. The lack of proper equipment and supplies necessary to perform certain surgeries and a lengthy committee process for acquiring any new supplies were the order of the day rather than the exception. Dr. Lantier and I were convinced that something about this didn't add up. We knew for certain who we were dealing with when, after the Murrah bombing, one hospital administrator in Oklahoma City publicly complained that his hospital hadn't received their fair share of the victims. We opened the Surgery Center of Oklahoma in May of 1997 and knew within 2 months that the highest quality of care with a full staff was not only possible, but could be accomplished profitably for about a tenth of what these so-called not-for-profit hospitals were charging patients. The hospital lies and propaganda have continued for many years, culminating in the one great lie that led so many to naively embrace Obamacare. I call it the Unaffordable Care Act. Hospitals, the big lie was that hospitals were struggling financially due to all of the uninsured folks utilizing their emergency rooms, leading to what we all know as cost shifting. I've written about this lie extensively, and we all now know that the hospitals get paid even when they don't get paid. In fact, to the extent that they claim they don't get paid, they get paid more. This is uncompensated care. This is the uncompensated care system they don't want anybody to talk about. A gift from Uncle Sam, and one which happens to be the engine for giant hospital bill creation. I would never have understood the various lies conjured up by the hospitals to maintain the fiction of their not-for-profit status had I not owned and operated my own medical facility. One of the first clues that something was amiss was that most insurance companies, in spite of our quality and pricing, avoided dealing with us. The answer to why wouldn't an insurance company like better and cheaper, although a mystery then, is apparent to us now. A look at this diagram will be helpful to you, I think. On the left, you can see giant hospital bill at the top and then giant hospital bill on the right. On the left, the panels under that show how the hospitals benefit from the giant hospital bill. Some of that is self-evident. On the right, it's how the insurance companies actually benefit from a giant hospital bill. And that sounds counterintuitive, but I'll walk you through it. First here, Hospitals bill for what they use, not for what they do. So they're inclined to be wasteful. They're inclined to use the most expensive stuff, open up unnecessary sutures, what have you. The more stuff they waste, the bigger the bill gets. They're actually inclined to be wasteful. Maximization of the uncompensated care scam. So understand that a hospital bills an amount, let's say it's $100,000, and then they collect $20,000. Well, then, don't you know they lost $80,000? So this $80,000 fictional loss helps them maintain the fiction of their not-for-profit status. What happens then at the end of the year is the difference between the amount billed and the amount collected, they obviously lost, they claim was care for which they were not compensated, uncompensated care. That then goes into a very complex formula and gets applied to what are called DSH, disproportionate share hospital payments, to pad their Medicare and Medicaid payments for the next year, which actually keeps that money off of the current year books, maintaining the veil. It's incredible. Then this one down here, a giant and uncollectible bill, like I said, helps maintain the fiction of their not-for-profit status. This is a very scaled down and simplified version. There are a lot more lines. There's a lot more sinister stuff going on. Over on the right side, the insurance companies, because a bill is a gigantic bill, that creates fear in the marketplace and tends to force people into groups and herds. And that basically allows the insurance companies to make more money, because rather than writing 1,000 policies for 1,000 people, they can write one policy to cover 1,000 people, particularly since everybody, left and right side of the aisle, has made sure that tax policy in D.C. favors the purchase of insurance by companies and not by individuals. This is one of the most evil things, PPO repricing. Hospital is $100,000 bill, gets paid $20,000. The insurance company goes back to General Electric, General Dynamic, Devon Energy, whoever. And they say, we saved you $80,000. You know, we had this $100,000 bill. We worked hard for you and ratcheted it down to $20,000. We saved you $80,000. We would like our 28% of that savings. And that amount varies on how big a gorilla in the marketplace that particular insurer is. When you think about that, you realize there's the answer to why the insurance companies didn't want anything to do with cheaper. They're actually inclined to seek out the most gigantic bills they can find to maximize their take on this PPO repricing scheme. Several people in the insurance business have told me that the revenue that these large insurers bring in on repricing actually exceeds that they take in on premiums paid minus claims paid. The other thing the giant hospital bills do is they provide a lot of fear. So then they can say your premiums are going up 10%, you know, the rising cost of health care. We've all seen that in our physician payments, right? I mean, so the rising cost of health care, and then the brokers actually make their commissions based on the premium. So they've got crocodile tears when they come in and tell big employers, you know, you're going up 10%, well, their commission just went up 10%. A thorough explanation of this is in a piece I wrote called The Anatomy of a Cartel, and there's a bigger explanation. One of the things that's going on too, you have to understand, some hospitals own their own insurance companies. How's that for a conflict? So you can see where the lines, I mean, they cross at almost every imaginable level when that happens. Our facility, wait. The only way to shine a light on this cartel was to post prices online for all to see. A move that we made 4 years ago next month. Incredibly, the first patients to take advantage of our pricing were Canadians, followed by patients from those parts of the country where the tight grip of the cartel and the subsequent lack of any semblance of market competition has rendered the high prices you would predict from such an arrangement. Our facility is now frequented by people all over the country and even outside of the country, patients with high deductibles, patients waiting in lines, patients with no insurance whatsoever, and increasingly, the fastest growing group are patients whose care is paid for directly by the companies for which they work, the so-called self-funded or self-insured. You can imagine the conversations that I've had with CEOs of large companies who've been paying $30,000 for operations that they now see that could have been obtained for $3,500 at our facility. You can also imagine the conversations those CEOs have subsequently had with their insurance brokers who have known about our facility and pricing and have nevertheless failed to alert their client of our existence. Our price posting has had another effect. Rather than travel to Oklahoma City, more and more patients are using our pricing to leverage rational fees at facilities in their hometowns. Just last month, a Georgia patient whose primary care doctor was aware of our website pricing was quoted $40,000 for a transurethral resection of his prostate, whereupon he informed his urologist that he was headed to Oklahoma City, where we would do this for $3,600. That's surgeon anesthesia facility, that's everything. After hearing the disgruntled urologist's reaction to losing his patient to Oklahoma City, the hospital CFO asked for details. The $40,000 quote was reduced to $4,000. I think it is fascinating that our pricing saved this patient $36,000, and we didn't even do the case. Before you give the hospital CFO too much credit, though, let's go back to our diagram. You see, he will simply claim that he lost $36,000. To bolster his not-for-profit fiction, plug that into his uncompensated care calculation, and collect a portion of this loss from the taxpayers. Everyone in this room as taxpayers would have therefore been better off if this man from Georgia had come to our facility after all. The time has now come that this hospital and others encountering patients familiar with our pricing have been thrust into a market economy, whether they like it or not. Having eliminated potential competitors with certificate of need laws all over the country, these corporate hospitals must now contend with our facility's fair and rational pricing just a short plane ride away. That other facilities are doing this with even more on the horizon removes several teeth from protectionist legislation like certificates of need, I think. The medical price deflation resulting from a new competitive healthcare market poses an incredible threat to the central planners who are counting on the runaway pricing and market chaos resulting from Obamacare, the price crisis intentionally created to usher in the sequel to their plan, single payer. As physicians who are paving the way for many to pursue third-party free practices, APPS members' contribution to this deflationary obstacle to Obamacare may have, in an effort to save ourselves and our patients, it may have discovered the soft underbelly of this latest attempt by government to crush the private practice of medicine. The deflationary effect of shunning third parties will, I think, when we look back years from now, represent the undoing of this horrible and deadly law. Thank you very much.